Hey guys, what's up and welcome back to my channel. My name is Josie, and on this channel I share a lot about natural hair, radiography and lifestyle. So if these are topics you're interested in, you might want to consider hitting that subscribe button and also turning on post notification so you never miss a post again. Today we're going to be diving into a very important question. What does the radiographer actually do? Now, if you've ever had an X-ray, a CT scan, or even a mammogram, then you've already encountered the work of a radiographer, whether you realized it or not. These professionals actually play a vital role in modern healthcare. Without their expertise, doctors, surgeons wouldn't be able to get the crucial images that they need to diagnose and treat patients accurately. But radiography is much more than just taking pictures. What we should ask ourselves now is, who is a radiographer? Radiographers are sometimes called radiologic technologists in some places. They are healthcare professionals that are trained to perform medical imaging examinations. Their main task is to operate complex imaging equipment to produce high-quality images of the inside of the body. Now, these images are used by doctors to diagnose injuries, diseases, and abnormalities. For example, a broken bone after a fall, detecting a tumor or a growth, or evaluating lung infections like pneumonia, or even in some cases to monitor a pregnancy through ultrasound. Radiographers are not just button pushers. They need deep knowledge of anatomy, physiology, physics, and patient care to capture images while keeping patients safe. Now let's break down what radiographers actually do in their day-to-day work. Radiographers greet and explain the procedure to their patients, often calming their anxieties. They check for contraindications, for example, making sure a patient with a pacemaker isn't sent in for an MRI. They help patients change into the gowns and remove jewelry or metals that could interfere with the scan. Proper positioning in radiography is everything. The radiographer ensures that the patient is aligned correctly to capture the exact area that the doctor needs to see. For example, in a chest X-ray, even a small rotation of the shoulders can blur details and affect diagnosis. Radiographers are also responsible for operating some complex equipment. This could include X-ray machines, CT scanners, MRI systems, ultrasound, or mammography units. They set exposure factors in order to produce clear images while minimizing patient risk or patient dose. Radiographers must also follow strict radiation protection guidelines. They use lead aprons, shields, barriers to protect patients and themselves. They calculate the lowest possible dose that achieves a diagnostic quality image. And after taking the images, they check for clarity, sharpness, whether the scan shows the correct anatomy. And if it's not good enough, they may need to repeat the scan, though always balancing patient exposure. The benefits must outweigh the risk. Radiographers don't typically diagnose, but they work closely with radiologists. These are the doctors who interpret the images. They may flag unusual findings or assist in interventional procedures. Radiographers can choose to focus on a variety of advanced imaging fields. General X-ray of radiography. This is the foundation department for bones, chest, and trauma cases. They could also specialize in computed tomography, which involves the production of 3D cross-sectional images vital for strokes, cancers, and internal injuries. Another area of specialty is MRI, magnetic resonance imaging, which involves the use of magnets and radio waves, excellent for brain, spine, and joint images. Again, we have ultrasound or sonography, which utilizes sound waves common in pregnancy scans, soft tissues, vascular imaging. Also, there is mammography, specialized in breast imaging for early cancer detection. Interventional radiography is also another area in which radiographers assist with minimally invasive procedures like guiding catheters into arteries. Each of these requires additional training and certification. For example, in Nigeria, yearly we have a list of courses which are put out by the Radiographers Registration Board of Nigeria, and one can enroll for these courses, basically for personal growth and to keep up with the growing trends in the field. These fields allow radiographers to pursue areas that match their interests, whether it's working with trauma patients, focusing on women's health, or dealing with cutting-edge 3D imaging technology. Unlike radiologists who mostly interpret images behind the scenes, radiographers spend a lot of time with patients. They need excellent communication skills because patients often arrive nervous or in pain. Most times when patients come in, they're even very nervous just seeing the machine alone. So radiographers must explain complex procedures in simple terms. They comfort children, elderly patients, and those with anxiety. They also adapt because every patient is different. Some might be unconscious, another might have limited mobility, or someone may struggle to understand instructions due to language barriers. Radiographers combine compassion with technical skills, which makes them unique in healthcare. And again, radiography isn't just about working in hospital X-ray rooms. Career paths include clinical roles, direct patient imaging in hospitals or clinics, education, which is training the next generation of radiographers. Research is also another aspect, which involves developing new imaging techniques and technology. They could also work in management, leading patients to radiology departments in some places. Radiographers could also take on industry roles, which involves working with companies that design and build imaging equipment. This flexibility makes radiography a very rewarding and dynamic career. This is not to say that there are no challenges present. Radiography is very physically demanding, moving equipment, assisting patients. There is high responsibility because poor imaging could lead to misdiagnosis. There are also emotional challenges when it comes to working with very sick or injured patients, knowing that you have to show empathy, not sympathy. That's it for this video, guys. If you found this video helpful in any way or educational, make sure you hit that subscribe button and turn on post notifications so you never miss a post again. Bye.